morning.
I haven't really
It's just like class. You sit in the back, and then you get 1 or 2 good mornings out of 30. Good morning. Welcome back to AU. Thank you for coming. We know it's a busy time of year for most of you, if not all of you, and I speak for Sarah and Ashley on how much we appreciate you coming in to do preceptor training. It is a requirement for our accreditors. I'm going to start off with a couple of announcements, and then we have quite a bit to go over today. First of all, you know where the food's at. Just if you're hungry, go out and get food in the middle of the presentation. That's fine. There's quite a bit out there. Those of you that don't know the lay of the land here, if you go out that door and straight down the hallway till we're at dead ends to an office, you make a right, the restrooms are right there. And then, of course, you all know where the exits are in case we have some sort of emergency. Just making sure that we have our emergency action plans in place. We also have biohazard material in the equipment room over there. So please make yourself at home, and I also have bottled water back there for you as well. We're up here today as opposed to the past 15 years being down in University Banquet Hall because they're renovating the cafeteria, they're renovating all the food service areas, they're renovating UBH. They're offline basically, so that's why we had to bring in food today instead of Sodexo, which is our food provider, bringing it in for us. So we appreciate your understanding with that. We are videotaping this. If you have preceptors at your sites that aren't here, Ashley is going to send an email out, and we'll have this posted someplace so that you can comply with the Katie requirement of going through preceptor training if you weren't here. So Ashley will follow up with that. A couple of other notes. This will be my last preceptor training here. Some of you may know, some of you may not. I am retiring on June 30th. In that respect, Sarah Radke, did I miss something? Oh. It just keeps coming. Professional photography, because I didn't even look that good on my wedding. Thank you. At any rate, Sarah Radke is going to be taking over as program director, and Sarah and I have been partners in crime for 18 years. The program in large part makes up the philosophy of us, and Ashley has come on board and fit in beautifully. Between the two of them, they're going to continue to take this program up to new heights. If you would have asked me 19 years ago when I arrived here, is Dave Mosky here?
He's on his way, he got lost.
Lost?
He went to the old
19 years.
No, you get the banquet hall.
Oh, gotcha.
So
There's guys with hard hats basically,
Yeah, so now he's got to go
with AK-47 saying go over here.
Right in.
If you would have asked me 19 years ago that we would have anywhere from 40 to 50 students in our program, that we would have 3 full-time faculty members, that we would have 30 preceptors, that we would have 30 clinical sites. You know, Aaron, this is Aaron Brissett. Aaron was a student here when I got here in '99 when this was an internship program. You're basically the last student I know that came out of that program. Although not true, Adam Kreckenberg, there's a couple that didn't come through. So Aaron remembers what was going on back then. We didn't have a lab. You know, Sarah and I were doing practical exams in closets in our office, wherever the heck we could. Jessica remembers those times, finding a little space someplace, and now we have our own lab. If you would have, and for many years when our students were graduating, they were, like many other programs, we were kind of at the average at the Board of Certification pass rate. Many of you have been around long enough time to know that the pass rate on the BOC exam was 30%. First time pass rate, 35%, 40%. It started to rise a little bit. And we were really always we were always average in that respect. Good morning, come on in. Grab food out there, that's for you.
There's a chair here, and there's one in the back corner. Front or back?
Great. So we were always at the average, and over the years, we just kind of figured things out that we could do to help our students, and our students have always, good morning, Dave. Where is there a chair for Dave?
Back corner.
Okay.
Front rows. You're 2 seconds too late.
So we were always at the average, and over the years, we continued to improve our methods, and we brought in new preceptors, and the preceptors, all of you have done such a great job educating our students, that when Katie decided that it was, in order to actually be a program in good stead with the accreditors, you had to have a 70% first-time pass rate over 3 years, and we continuously continue to grow that to the point at which we've been above 90% for about the past 4 or 5 years. That is in large part due to everybody in this room, those preceptors that aren't here, the faculty members, our adjunct faculty members. It takes a village to build what we've built here. And again, in 1999, and when Sarah got here in 2000 or 2001, I don't know if we could have dreamed that the program would grow to this size and to have the success, because our students are getting certified at a really good rate, and they're getting jobs, they're good alumni, and most of you, sometimes you'll see them out and about, some of them even work, we've got some of them working for some of you. ATI is a big employer advocate. So, in that respect, I really appreciate all the hard work that you put into this. As an athletic trainer, it's great to have students there to help you, but at the end of the day, from our standpoint, and I've been in your position, I was 16 years, I was in the field with students that really helped. You need to have other hands, particularly if you're at a high school. But from our standpoint, you're also educating our students. It's really important that you educate our students. And when the accrediting body came in, the self-study team, both in 08, in 03, 08, and now, they commented on core faculty, and they commented on how engaged our students are. And I think they're engaged not just because of us, but they're engaged because of you, because you model really that great behavior of what a professional athletic trainer is. And those of you that have seen students over a period of time, you realize there's some students here, there's some students here, there's some students here. Sarah and I are lucky enough to see them, and Ashley, when they graduate, to realize they kind of all end up here. Most of them end up here. And then they continue to grow. You all were students, you all graduated at some point, and you're all new, and you had to make the decisions on your own, and not easy to do. But we get to see that growth as well. And again, I can't tell you how much I appreciate what you've done for our program, because you are the backbone of our program, in my opinion. We have no program if we don't have you educating our students. So I applaud all of you for that. So thank you for all the work that you put in, and I hope to see you down the road, maybe at an NATA convention sometime, or just out and about. So I appreciate that. So now to move on the program a little bit, my portion is to talk a little bit about the KD site visit that we had.
I think I'm done, right?
Okay, well, Sarah, since I know you don't want to do this, say a word.
No, I think you got it covered, actually. Covered everything.
So moving forward, of course, Sarah, as program director, is going to be communicating with you on a number of veins, and as we move forward, as we transition to the masters. But I am going to catch you up a little bit on that before Ashley starts her program. So Sarah, thank you for coming.
Yeah, sure. I was gonna hang out, but there's no chairs. Bummer. I'll see y'all soon enough.
So in February, we had our KD site visit. That was the site visit that aged me about 10 years. Having gone through 3 of these, it's tense because, you have to do well. Otherwise, it's a reflection on you. That would be myself and Ashley and Sarah. And we've gone through 3 of these, so we kind of know how they work, but it doesn't mean that you can fall on your face. I've heard many programs not do so well. There are 109 standards. Many of you know a lot of them because I would email you all spring long about making sure you did this and did that and did this and did that. And you all did what you needed to do, and we were able to put it all together for the self-study in July. They came here in February. Out of 109 standards, we had 1 non-compliance. You should have all seen the email I sent yesterday. That was the non-compliance. It had to do with the 2 weeks prior to coming to campus. And really, they had a really good point. We really didn't have any guidelines for them as to how many hours they needed to put in during those 2 weeks. And there was no minimum, there was no maximum, and they even had a hard time figuring out where to put the non-compliance, because we were compliant in terms of minimum hours and maximum hours for each practicum, but not that 2-week period. So someone can come and do 10 hours because they didn't have maybe many opportunities, and they can get 50 points for that particular 2-week period, and someone could do 110 hours and get 50 points for that 2-week period of time. They needed a minimum and they needed a maximum. So we figured, based on previous history, 40 hours is the minimum they have to do, a minimum of 40 over 2 weeks, and a maximum of, what was it, 150, okay? And chances are they're not gonna get that, but we set it at something that potentially, depending on what they're doing. Because that would be just too many hours anyway, but we gave that minimum and that maximum. And now that minimum is really where the number is set. It's like all our other practicum courses. They just need to go and do the minimum number of hours. We'd like them to do more. We have something written in the handbook that says, you know, you're supposed to fulfill the duties of an athletic training student throughout the experience. So even though they're done, we're still asking them to continue, but technically, the minimum is what they're required to do. They're not required to do any more than the minimum. And Katie requires us to have a minimum number and a maximum number. So that was the one non-compliance, and we as a group actually basically drafted the response to the non-compliance. And part of the satisfaction for Katie was us sending an email out to the preceptors and the students that this is the policy. So you all now know the policy. I got one email yesterday basically asking for a little explanation, and I provided some of that explanation for that. Does anybody have any questions about that one non-compliance? Super.
Well, if you have any questions about the rotation as a whole, we were going to talk about that a little bit later, so save those questions, but the non-compliance, you can ask questions on.
So they had a lot of really good things to say about the program. They said a lot of good things about the engagement of our students, the engagement of our preceptors, the core faculty, our assessment plan and program. They really didn't have a lot of bad things to say. It was really just that one item with the minimum maximum number of hours to that. We may have to grab another chair. Oh. We got a chair over there. So it was a very successful site visit, and I want to thank each and every one of you for helping on that. You can breathe for 10 more years, because that's the next site visit. Moving that forward, many of you, if you don't all know, we're transitioning to the Masters. So this year, the freshmen on campus will be the last freshmen from this past year that will go through the 4-year BS program in athletic training. This year, we were approved by the Higher Learning Commission to offer the Masters. And what that is a 3+2 dual degree Masters. Students will come in, major in exercise science with an emphasis in athletic training. The athletic training courses will come in their 4th year. So the first 3 years, it'll be exercise science and general education. In the 4th year, they'll take the first year of their master's courses, provided they have the GPA to get in, which is a 3.0. After the 4th year, they'll graduate with a degree in exercise science. They'll have a summer internship. And then their 5th year, they will finish their 2nd year of their master's. Those are the students that come on campus to do the 3+2. The other school in the state that has their master's up and running is Trinity International up in Deerfield. We are in the process now of getting Katie to approve our program. We just, immediately on the heels of the last self-study, I submitted another self-study in April 1st. And they've already read the self-study, and there was only one item we needed to basically revise, and that was our retention policy for students coming into the program. So I anticipate Katie approving the Masters by the end of the summer, because it takes time for their boards to meet. Technically, we wouldn't have to be approved by Katie until our first group of students come in, which is not for 3 more years. But we will be approved, and we'll be the 2nd school in the state of Illinois to be approved for the Master's program. This year, we had about 40 students, 35, 40 students come in as freshmen. We have approximately 10 to 12 Bachelor of Science students. That's what they're going to do. And then we have another 12 or so that have elected to do the 3+2. It's also a standalone 3+2, meaning if someone has a degree and has the prerequisites, they can basically come right into the master's program by taking those, the first year of master's level courses. And I do have a couple of students that actually have degrees that are getting their prerequisites. They're just picking up a couple of things here or there. And then in the fall of 2020, that'll be the first year we have our first set of master's level courses. Now, I'm not going to spend much more time to talk about the framework and the curriculum because it's 3 more years away. And Ashley and Sarah will go over that ad nauseum because there are some significant changes to the curriculum, but we don't need to go over that right now.
Well, we're also going to talk about that later.
Okay, there you go. So that's a little bit about what's happening with the program. This year we had 7 students graduate, 6 of them passed the VOC exam. That still keeps us up above 90% pass rate on the VOC, and then the national average is around 80 something. And but that's where we're sitting right now. Hopefully, we can continue that mode because that's still really good. Sure, the expectation is for everybody to pass. That's our expectation. I think the students see that too. But still, that's really good, and we're proud of that as well. Before I give it over to Ashley, the next item is, most of you know when you come to come to Current Trends in Sports Medicine, we would announce who the preceptor, clinical preceptor of the year was, and it would be voted on by the seniors, and then the following February we would provide the certificate or the plaques, and we would announce it. But as you know, Current Trends in Sports Medicine has gone away after 14 years. Long story short, the university was looking for programs like ourselves to start to reduce the number of activities we were doing, basically to improve quality of life. So Current Trends, we kind of let go of Current Trends. It was a great program. It was great to be able to offer free CEUs for all of you. But that has now gone by the wayside. Who knows, maybe down the road it might come back. But at this point, what we're going to do moving forward is we're going to announce that winner at Preceptor Development every year. So we have 2 awards to give this year, because one would have been given to the athletic trainer that was voted on last year by the seniors, this 2017 seniors. That person would have gotten the award at Current Trends. And then this year, and that's the way we're going to do it from now on, this year seniors voted on one. So the first person from last year was out at Matea High School. His students had some great things to say about him, as they would, and usually we kind of have them fight it out when they have 2 preceptors that might be worthy. But at any point, I'd like to simply announce that Joe Kaufman was our clinical educator of the year from last year, 2017. Joe, congratulations. Oh, you know what? We have to Oh, we have. Lance?
You're good.
Suitable for baseball. All right, thank you, Joe. And Joe is going on to, I won't say greener pastures, he's still sitting with the Matea people. Joe, where are you now?
I work for Advocate now.
Advocate, okay. All right, the second preceptor, was voted on by this year's graduates. Ashley conducted that with the senior class. This preceptor's been here for, let's see, does she know who, yeah, how many years have you been here, Meredith? 3 years. And the students have really latched on to her, as they have most of our preceptors, but had some great things to say. I know there was a big fight about who was going to win, but Meredith came up on top on this one. You can thank the seniors for that. But I'd like to welcome Meredith Simpson to come up here and Thank you, Meredith. All right, so to that effect, I will leave you to Ashley for the rest of the workshop. Again, plenty of food outside, so make sure that you, if you want, just kind of open door in and out. Don't worry if we're doing this in the middle. And then I'll catch you at some point in time this morning. So enjoy.
All right, and I will not be offended if you want to go and get food. I have no problem with that. There's more than enough of it out there. So food or coffee or whatever you need. So we are going to, before we actually get started with the actual program that I wanted to do, I wanted to announce one more award that was given. So every year we pick a clinical athletic training student of the year, and that's chosen or nominated by you, the preceptors, and it is voted on basically by the faculty and based on how many recommendations and nominations and such that they got. And so this year, it is Josh Walter. So he was presented with this award at our senior reception for the graduates, and so he's obviously cannot be here today to do all this.
You need to see that one picture,
just
though.
to give you a little bit of an idea. So we like to have fun here. So this is Josh, and he's where's. Does he have a job yet? I can't remember.
He has an interview tomorrow.
He has so much stuff going on. I feel like everybody's got an interview like this week too, so we should be hearing about jobs and things of that nature for our seniors here coming up. But so Josh won that award and he was very excited about it. We got hundreds of pictures and I'm sure they'll be on Facebook pretty soon. So if you'd like to see those, that's where they're going to be. So, all right. So to really start off with what we're doing, I really wanted to spend a lot of time trying to go through and figure out exactly where we can make our program better. And I think that's always the goal, is trying to evolve and change what we need to do in order to actually get to where we want everything to be. So we are going to start talking about with expectations and student involvement. I know that we had some questions and concerns and comments this year, especially because I came in and literally changed around everything. So, and I kind of apologize for that, but I don't at all. So this is where we're at. So first idea is direct supervision. And if Sarah saw this, she'd be really mad at me if she saw this picture. But so direct supervision, I think we all kind of know what direct supervision means. You have to be able to intervene on behalf of your patients, on behalf of the athletic training student. This is written into our KD standards. It's a requirement for all of us. The one thing that direct supervision does not mean is obviously that you have to be there over their shoulder every step of the way as they're going through this. Okay, so we really wanted to hone in on that idea of supervised autonomy. And supervised autonomy is something that we've kind of gotten away from using in terms of vocabulary, in terms of how we talk about our clinical rotations. But the whole idea behind this is whatever you feel these athletic training students are capable of, you can let them do. They have the ability, if they've learned it in class and it's something that they should know, force them to do it. I have absolutely no problem with that. If they're going to make mistakes, I want it to be in a controlled environment. All of these clinical rotations and all these clinical sites are a controlled environment. That's exactly what I want for them. This is also paying attention to student skill level and keeping that in mind. The student skill level is probably our most important piece of this. You have to be able to know what these students are capable of in terms of what classes they've had before and all of this. Specifically so, you can rate them on how they're doing in terms of their clinical skills based on their skill level. Probably the most important piece of this is how they're going to be rated, so this is what we need to be able to know. If you ever have any questions on what a student is capable of, what a student is able to do, what skills we've gone over, what skills we're working on now, please send me an email, ask me, give me a phone call, ask me. I have absolutely no problem sharing that information. I don't always get to the point where I'm saying, hey, we just went over and finished knee evaluations and they all passed, so you can all do them. I don't really have time to go through and email everybody that on a regular basis. But if you have specific questions, please let me know. I'd be more than happy to share that information with everyone. There was also a couple questions about this year about the teachable moments idea. So teachable moments is a little bit different than what they're able to do in terms of being autonomous skill. So this is going to be a situation where it has to begin with a preceptor demonstration. This is something that the students have never seen before, or something that they have only seen once before, have not learned in a didactic course. All right. So for the treatment or technique that you're delivering, the preceptor has to remain engaged and present. All right. So keep in mind that until they've learned it and been tested on it, they cannot perform it autonomously. This is also a situation where you kind of have to use your own judgment, okay? For example, if you're trying to teach them trigger point release for a muscle belly, like there's only so many things that they're going to have to learn in a class before they can actually perform the trigger point release of a muscle belly. If you take that and then you look at setting up an ultrasound treatment, two very, very different situations. The trigger point situation, I would be much more comfortable with them doing autonomously after they're being showed it by a preceptor than I would them setting up an ultrasound treatment. Does that make sense? So within reason, this teachable moments, you have to be there the entire time. Always a gray area in terms of what our accreditors are looking for and what's capable of. So that's one piece of it. Going somewhere else with this too, completely forgot. Okay. So with the teachable moments idea, this is really supposed to be built in for teaching those skills that are not going to come up or comes up fairly rarely. For example, you have somebody with an ACL tear. This is the example everybody uses. Somebody with grade 3 ACL, rupture, gone, right? They're doing a Lockman's. They've never seen a positive Lockman's before, ever, because we can't really replicate that in the lab, okay? Even if they've never gotten to the point where they're at evaluation skills, they're a sophomore in the program. They haven't even gotten to lower assessment yet. If you have a positive Lockman's and you want to come over and show them how to do a Lockman's and see what it feels like, obviously absolutely no problem with that. However, the next time that comes in, you're probably not going to have them just have that and do that skill on their own. Make sense? Okay. And I should just say, if anybody has any questions at any point during this is supposed to be fairly informal, so just please raise your hand or just blurt out the question like our students do in class. It's really up to you, but I would love to give information if anybody has any questions. So, another area we are trying to focus on is this exposure to lesser seen skills. What we are finding, the transition of practice research that we're seeing coming out of most healthcare professions, especially athletic training, is that the skills that students are not quite at the proficient level yet when they come out of school is more the soft skills are the ones that they don't often get to see. So if we think about it, the students that are coming in on the traditional setting, they have classes in the morning, they come to clinical in the afternoon. There's probably a large chunk of things that they are missing because they don't have, they're not there while it's happening. The insurance and billing, the calling up for physician appointments, the sending emails back and forth and doctor's visits. All of those things are not something that they necessarily get to see because they're not around for it, okay? So as much exposure as we can give them to some of these skill sets, the participating in pre-participation exams, the interactions and communications with physicians, the soft skills, so the giving injury reports to coaches, the speaking with parents to a level, okay? Communicating with the student athlete in terms of what is actually happening with this injury and how this injury is actually going to impact their life. All of these skills are what we're really trying to add more of into their clinical rotations and into their clinical experiences. So if this is not something that's going to happen in a natural way, if you're not able to give them some exposure to some of these things, really? You can create things that are going to go along with this. Okay, so the injury reports to coaches is probably a really good example. If you have a coach that you get along with very, very well, or a supervisor you get along with really, really well, and you have absolutely no problem having this student give the injury report for the day, that's something that they can be forced to do, and it will actually help them with some of these things. SOAP note writing is always a big emphasis, and especially now that I'm taking over the practicum courses, I think most of you will notice that a lot of their assignments for their practicum courses are related to SOAP note writing and injury reports. And so this is going to be a big piece of it. The assignments for the practicum settings, a lot of these have to do with given scenarios that they're going to have to talk through with you. So it exposes them to a few more of these things. So the mental health referrals, the general medical situations where they might have to come up with an emergency plan for these management situations. All of these assignments are designed to give them a little bit more exposure to these soft skills and to these transition to practice things that we're seeing missing within the new graduates. And then any clinical education discussions that you might have, you can center them around some of these things. Okay, well, you have this situation and this situation. These people are having this conversation. What are you going to do about it? Like, where's your thought process? Walk them through the thought process. Make them actually make a decision. Make them actually go through and do some of these things. So these are all suggestions to introduce a little bit more of this idea into the clinical rotations that we're seeing. If you need specific examples, if you need specific assignments that might hone in on some of these things, please just send me an email. I'd be happy to send you whatever I have for it, okay? And I'm not sure how much time you have to be able to interject some of these things, but anything that you can do is going to help our students out. So we would really appreciate that. Okay. So the summer intensive. Unbeknownst to me, and I'm not really sure how this has functioned fully in the past, because like you said, there was very, very vague guidelines in terms of what they were supposed to be doing for this. Here's what we've done and changed it, all right? So this is the 2 weeks prior to classes starting, they have no didactic responsibilities whatsoever, okay? Our accrediting body requires them to have 1 day off a week. Outside of that, it is you as a preceptor who gets to decide how much they come in. They can't say I have to work, they can't say I have this, they can't say I have that. Family expectations, I mean, you can negotiate stuff like that with them. However, the whole idea behind this is a fully immersive experience. They need to experience the totality of what an athletic trainer does on a regular basis during preseason, okay? So the day-to-day, week-to-week role of an athletic trainer is the whole idea behind this, okay? So if you're working football, and unfortunately we're capping it at 150 hours, but for 2 weeks, but if you're working football and you're there for 3 days, students gotta be there for 3 days. That's their life, that's their expectation. That's how it is, okay? You can change that and alter that based on how often you want them to be there. I know that there's some students you don't wanna see for that many hours a day, but you get to make that determination, you get to make that decision for those 2 weeks, okay? Once school starts back up again, the rules and regulations are going to change a little bit. However, for these 2 weeks, they have to have a minimum of 40 hours, maximum of 150 because we had to cap it somewhere. And then the 35 patient contacts is required for this to get full credit for this experience. So, once again, 1 day off a week. Work is not an excuse. As much as you deem appropriate. Okay, and then it enables the students to see the totality of care. If you were sitting around the athletic training room waiting for your students to get tested out on 1 rep max for bench press and things of that nature, consider if it's a appropriate or a necessary clinical experience these students need. But I'm leaving that up to you. You are the preceptors. You are the experts in that realm for this. Okay, so this is really what we're trying to do with this summer intensive. So the patient contacts idea, the NATA and our accrediting body, Katie, are moving away from this idea of requiring a certain number of hours. I have a feeling with not the 2020 set of standards, but the next set of standards, we're going to move away from having to count clinical hours completely. What they're really trying to do is move to this idea of patient contacts, okay? And so these are the 5 possible areas where students can obtain a patient contact. Okay, so emergency procedures, this is going to be for your, getting out your vacuum splits and actually using them, having to stabilize C-spine on an athlete, the splints and the bracing and things of that nature that's in an acute emergent situation, okay? This is what our emergency procedures are. First aid and preventative care, this is all of the taping, all of the bracing, all of the splinting for non-emergent situations. So everything that they tape, they can get a possible 2 per patient contacts for that. So if you have somebody who needs both ankles, both wrists, an elbow, and a knee, they can only get 2 for that person, okay? But so, and it's not going to be an exact science. They're going to miss some, they're going to over-exaggerate on some, they're going to miss a few patient contacts on others. However, this is about as best as we have because it's going to be self-reported anyway. The hours, too, are self-reported. So if you want to have a whiteboard up and keep a tally for how many patient contacts they have, you go for it. But it's not really necessary that they get an exact number for this. We felt that the 35 over 2 weeks is not really asking the world, especially if they can get two tapings per person, per practice is really what it is. Treatment modalities, we're doing a maximum of 3 per patient. So if you have somebody who comes in and they end up doing you end up doing ultrasound on them, then you end up doing a massage treatment or manual therapy treatment, and then you're doing a ice cup after practice where the student's actually applying the ice cup, right? There's your 3 treatments, okay? This does not include the ones where they hand out an ice bag and tell people to go away. That does not count as a patient contact. They actually have to do something active with that patient other than wrap an ice bag on their knee, okay? So, and the students know this too. So active participation on part of the student. The next one is evaluation, so assessment of our general medical injuries or musculoskeletal injuries. They can get a patient contact for each assessment. And then rehabilitation. 1 per injury, so this is either if they develop a plan, because they are able to, based on what their skill set is and what classes they've taken, that can count as a rehabilitation. Or if they take an athlete through a rehabilitation program and they are able to provide correction as necessary as they go through it, whether it's, you know, in terms of you only did 9 and you're supposed to do 10, things of that nature, that's fine. For some of the younger students, especially the sophomores, this is something they're going to end up doing, okay? So they should have some exposure to the corrective techniques. They're not going to have a ton, but it's still something they can get a patient contact for. Does that make sense? Okay. And this is really per practice we're looking at for patient contact. So if you have 3-a-days and you have to go through this entire situation again for each practice that you have, they can count those clinical or those patient contacts as new patient contacts for each time they see that person per day. So if we're doing multiple treatments, they don't have to just limit it to the 2 preventative care first aid. It's not just per day, it's per practice or per actual treatment. So here's where it gets a little bit interesting. So the clinical rotation scheduling that we're having them do, once they get back into they're taking classes and they're doing their clinical rotations at the same time. This is how we want you to be able to set this up. So for clinical rotation scheduling, we keep in mind that our minimum number of hours for our sophomores is 150. This averages about, after, let's see, 15-week semester, we'll say it's supposed to be 16, but 15 weeks is usually about how much they're there. Averages out to about 10 hours a week, okay? So that is the bare minimum that we're requiring of our students. We technically cannot ask them to come in more than that, okay? However, it kind of varies, and you all know your schedules much better than I do, okay? So averaging 10 hours a week, you get to prioritize when you want them there, okay? So, for example, high school football. When is the day that high school football is always going?
Friday.
Friday night, right? Expect to work Fridays. That is an absolute 100% can be a priority. They cannot tell you they can't work Fridays. They're working Fridays. That's how this is going to work, okay? So you get to prioritize the days of the week where they are going to get the most out of their clinical experience. All right, you can also plan for potential lulls in clinical hours. If you know during Thanksgiving week that you're not going to have them come in because nobody's coming in on Thanksgiving week, you can either front load some of those hours or make sure that you have enough experiences after Thanksgiving that they can get those 150 hours. If a student wants to come in more than the 150 hours or the 225, whatever it might be, that is okay. We just have to make sure they are getting 1 day off a week, okay? We cannot pressure them into doing more than the bare minimum, okay? It can't be reflected on their evaluations. It can't do anything like that. We cannot require them to do more than the minimum, okay? They're probably going to come in and every single one of them knows this is how they should be doing this. How well they do it, I'm not so sure. There's a few of them probably do it really, really well. A few of them are really struggling with it. However, this is the way this conversation should be going from here on out, okay? So here we have an average 10 hours a week. You get 4 hours on a Friday night, okay? So there's 4 hours taken care of. 6 hours throughout the rest of the week. So we have, 2 other days where they come in for 3 hours a day. There they go. There's their clinical experiences for the week, okay? And as far out in advance as you can plan these, the better off it's going to be for the students. We have a lot of students who like to schedule work hours if they can outside of their clinical rotations. I'm realistic, I know, they have to work to pay for school, I get it. However, this has to come first, okay? The only exception to that is, once again, when we have our student athletes that are in season. If they are not in season, clinical is a priority. If they are in season, unfortunately the sport has to be a priority. However, out of season sports, I don't want to hear about we have fall baseball and I can't come to practice because of fall baseball. Don't want to hear it at all, okay? Your clinical is your priority during the off season, okay? So if you're running into some of that and you're having struggling with some of these conversations, please let me know. I will take care of it. Yes, Heather?
Hi, question. Are the students aware of this? Because obviously the freshmen are transitioning into the program if they are to make it. So is that conversation being done in the spring before they get into the program, or is it waiting until we get into the fall?
No, it is a conversation that's already been had.
Okay.
How many of them are actually paying attention to me when I say these things, I'm not sure.
But it's been said.
But it's been said, it's been written into their policies and procedures manual that they all agreed to. The coaches all know about it.
Okay.
So this should be something that should be a non-issue. I know it's an issue, but it should be something that's a non-issue. So if you are experiencing a student athlete who is out of season and they're saying, I have to go to fall baseball or whatever it might be, you can say, all right, clinical's priority in the off season. You have, every single one of you has the authority to say that. Clinical is a priority in the off season. Your coaches know that, you should know that, this is what we're doing. I don't care if you have fall baseball, okay? You have the right to say that. I'm big blanket statement right now, you can say that to people, okay? So that's where we're at for clinical rotation scheduling. They are all aware,
If
yes.
they are cross-country, track and field, obviously they're in season for 3 seasons in a row. Are
Right.
they just supposed to be?
So the whole idea behind cross country and track and field is they are supposed to pick whatever their main season is. If you
Okay.
have a multiple season athlete or multiple sport athlete, that's probably the only case that we're actually going to have a multiple sport athlete within the athletic training program. So they are supposed to pick whatever their main season is. So if they're mainly a cross country runner that happens to do track because the coach needs them to do track, they are in season for cross country, and they can get to track practice whenever they get to track practice. So that's kind of how we're working those situations. Okay. Moving on, we're going to do a few policy changes. Okay. First of all, we have new clinical sites that we've brought on for this year and for next year. So we can welcome all of our new preceptors as we keep growing and expanding. There's a lot of great things that are happening here, and moving forward, we're going to have an even bigger pool of sites as we move to this master's program. So I'm not going to announce names and do congratulations and things of that nature. I don't think anybody really wants that. So we're have the list up here. It is potential that they are going to be going to most of these sites. So site visits. Given the idea that we are now expanding sites and we've just added 8 new sites, you are not going to see me twice a year anymore. I'm coming 1 time a year because that's all that's required. We have not had any really issues with our clinical sites that we've really needed me to experience and come on a each semester basis. There's no necessity for me to do that. So it will still function very similar to how it does this year. Okay, I will come. I will let you know I'm coming. I will let you know when I'm coming. It's probably going to be the exact same form that I had to fill out this year. I'm going to ask you the exact same questions. Are there things that are content areas that we need to beef up our education on? Is there any overall weaknesses or things that you'd like to see change? All of those questions are still valid, okay? And you don't have to wait for a site visit in order to give me that information too. If you are noticing going through this that there's a certain group of students that aren't very proficient in whatever they're supposed to be proficient at, just shoot me a quick email saying, hey, we're noticing that 3 or 4 of these kids are not up to speed on their thumb and wrist taping, whatever it might be. Is there some way we can work that into some of the classes in order to actually get them a little bit more exposure to it? I have no problem doing that, okay? If you want to save it for your site visit, just so you have something to tell me when I ask you, is there an area that you can increase? I have no problem with that too. So one thing to pay attention to is that any clinical sites that score below a 70% on our student evaluations, we are going to do a site visit, we are going to do a remediation just to make sure that everybody's on the same page, and just so that we can make sure that we can figure out kind of what's going on there to bring that site back up to where we want it to be, okay? Safety checks. Here we go with safety checks. Okay, here's what we're going to do. Our National Fire Protection and Safety Code. Safety Code Association, yeah, that one, this thing. There is a biannual requirement for safety checks on all of your modalities and all of your treatment machines, okay? So this can be done by a maintenance staff or electrician. It does not have to be done by the same person that calibrates the equipment. The calibrations are a yearly thing. Safety checks are a biannual thing, okay? And for those of you who actually have GFIs or have modalities and things of that nature, the maintenance staff or electrician should be coming in to check your GFIs too. You just don't have to report that to me. That's just good practice for you as a clinician to have that happen, okay? So the GFIs do not need to be reported. However, what we are going to do from now is on August 1st, 2018, I need record of all of your calibrations and all of your safety checks for the last 12 months, okay? You are the ones who are gonna have to make sure that you are getting them checked at the 6-month mark. I don't need to collect them at the 6-month mark, they just have to be done. So when I get that form back from you, it's the exact same form that we had this semester. All of your modalities are listed on there, and then all of your safety checks are listed on there for the last 12 months. So at that 6-month mark, you should have safety checks completed on everything. Does that make sense? Yes.
Is there a way that August 1st date can be changed? Like, I'm not in school then. We haven't started high school yet.
Okay.
So I'm not in school all summer. So I don't know when I would be able to get that. Like, I can get it done as soon as we get back to school.
Okay, so what would be a good date for everybody then?
Yeah, if we could do September 1st, that would probably be better. Or even like August 20th would be fine.
Okay. Well, so the reason I picked August 1st and the reason we have to have August 1st is we have students that are coming to your site prior to that report date if we do September 1st. And so they're not able to use any of these things if I don't have those calibration records. So that's
I mean,
why.
you have the ones that I just turned into.
Right.
Yeah, yeah.
They're good
So
for
they're
you,
up to
though.
date right
So
now.
they should be good for a full year.
Yeah.
So the reason I did August 1st is because they are up to date until, what, now-ish? Calibrations are basically right around
No,
now.
I
is when
turned a
most people
safety
got
check
that.
into you a few months ago.
Yeah, but the calibration thing is more what I'm worried about because that's more what Katie's worried about. So Katie's worried about the calibrations, less worried about the
That's
safety
what's
checks.
happening.
Yeah, we're happening right now. So,
I was gonna say, I'd rather do them at the end of the year then,
Yeah.
personally.
at the end of the year?
Yeah.
Okay,
Yeah.
so,
No, because they're being calibrated right now.
so if I move, okay, so if I end up moving this up to, let's say I move it up to June 1st, you can turn it in any time from now, actually, here, why don't we do it this way? You can turn it in at any point in time from the end of the year until August 1st. It doesn't have to be on August 1st, just turn it in. As long as I have them prior to that student's getting there, you can set up whatever schedule you need to that works for you. So if you'd rather do it at the end of the year, have at it. Do it at the end of the year, turn it into me early, that's just fine, okay? August 1st is gonna be, has to be our minimum in terms of when we get those in, because I can't have calibration records, or students at sites that don't have calibration records with me. Does that make sense? So anytime between now and August 1st, you can turn in whatever you need to. Okay? Yes.
The safety checks that I use are those ones that are in wetlands and above water, or all of them? Because that's the 6 months that's supposed to involve water.
Right, so it was those that involved water because
Everything
the
else
other
is
ones had
water.
already had the calibrations for it.
Everything else
So
is-
this is the most frustrating code in the history of time because nothing is clear, okay? So